So welcome. Today we're joined by Chris Tuttle, the CEO of Bridgewell. Bridgewell is a human service agency supporting individuals with intellectual and developmental disabilities, as well as much more. So thank you, Chris, for agreeing to the interview. Really appreciate it.
No, I appreciate you having me today, Art. Thank you.
So I'm just going to jump in with the hot topic of the world, and that is, how has your organization been impacted by COVID-19?
We have been impacted on several different levels. I mean, the first one is financially.
Yeah.
It's had a significant impact on us. We closed our 5-day programs on March 16th. That had a significant impact for us. That had a ripple effect to our transportation department, and we ended up laying off close to 90 full and part-time drivers.
Wow.
Once we closed our day programs, we had to reconfigure how we were going to do our outpatient clinic work. We had to reconfigure how we were going to redeploy our day staff. So fiscally, this has had a significant impact for us. The other areas that are impacted that have impacted Bridgewell for this is, there's an emotional toll that has been an impact. Our frontline staff, we have 66 group homes. Our frontline staff are essential workers. They're working every day in our programs and working with individuals who have tested positive with COVID-19. We've had a number of staff who tested positive for COVID-19. So there's that emotional toll that has taken an effect with staff. There's a personal toll. We've had, unfortunately, a couple of individuals who we serve at our day program have passed away due to COVID. And we've had one individual in our group home pass away due to COVID. And that has taken a personal toll on our staff. These are staff members who have worked with these individuals, in some cases for close to 30, 35 years. I think what we're just seeing now and the aftermath of all this is the mental health of the frontline workers is going to be kind of the next wave of this COVID impact. So we're getting geared up for that. But those are the big things that have kind of impacted us and how we look and do business.
Yeah.
I think we have spent our time kind of reevaluating our practice and what it's going to look like post-COVID, if there ever really is a post-COVID.
Yeah, I mean, to your point about the group home and the staff, and I have an uncle that's in a group home, and the whole home tested positive for COVID. Thankfully, everybody was asymptomatic and still remains healthy weeks after. But his direct care team stayed with him, working 12-hour days, 7 days a week, and made incredible sacrifices on behalf of taking care of the individual served, which included my uncle.
We've had the same thing. We've had staff and other providers also have had the same thing. We've had staff hunker down in the program for 2 weeks. They'll work 16 hours on, go home, sleep for a couple of hours, and come back. And the emotional toll that I mentioned before, we saw early with one of our program directors who her home had tested positive. She was waiting to get tested, but she lived with her elderly father. So the emotion and panic of, do I go home and expose my father more? And this staff member rented a hotel room for 2 days until they got tested and got the test results back. So this is a lot of what our staff are going through at this point of not just the heroic work they're doing in the programs, but the internal turmoil they're dealing with of, I'm going home, I'm potentially exposing my family to this and all that. And I am I am incredibly grateful to the work staff and the dedication that they've shown.
Yeah, they're amazing. You hear a lot about the attention that the healthcare system is getting obviously, but I think equally deserved is the folks working in the human services agencies that are out there taking care of individuals, because they don't get the break.
They don't, and nothing to take away from nurses, doctors, hospital workers, but a large number of our staff are working directly 8 to 10 hours a day with individuals who are COVID positive.
Yeah.
And I think part of this in the early stages, what the impact was in the early stages is we weren't prepared for a pandemic. So though we had PPEs to begin with, because we work with a population that is elderly or needs a lot of personal care assistance, we had gloves, we had some gowns, we had masks and all that, but not nearly enough for when the pandemic hit.
Mm-hmm.
So in those early stages, following the CDC guidelines, in the early stages, the CDC was saying if somebody is symptomatic, they should wear a mask, or if they are COVID positive, they should wear a mask. I mean, in the early stages, we had staff in trash bags because we didn't have enough gowns. That was the other significant impact. We're much better now. But in those early stages, that really played into a lot of the emotional
stress levels,
the emotional state, a lot, the stressfulness for our staff.
Yeah.
During that early stages, because we just, like many providers, like the sector, we were not prepared for a pandemic at this level.
I mean, I imagine it takes a toll, especially on the CEOs being responsible, not only just for the health and well-being of the organization, but more importantly, kind of the health and well-being of actual lives. What's been your biggest challenge throughout this whole journey crisis?
My biggest challenge is trying to find sleep. I don't think I've had a good night's sleep since mid-March. But to your point, absolutely. We were talking about this the other day. Since early March, we've all been on this heightened sense of alert
mm-hmm.
for the last 9 weeks. This anxiety-driven turnwheel for 9 weeks. And I think, to your point, yeah, you take it personally that for myself here at Bridgewell, we have, we serve 6,000 people. We have roughly, between our housing programs, 24-hour group homes, our recuperative care program and all that, 24-hour living that we're responsible for is roughly 700 to 800 people. So I take that responsibility very seriously about keeping them safe. And then the 700 to 800 staff members that are working with individuals in 24/7 programs. And I've gotten very familiar on how to purchase PPEs, gotten very familiar how to, what are good deals and what are bad deals. And I got to tell you, in the very beginning, we were getting some bad deals. We found a supplier who promised us touchless infrared thermometers. We bought 20 of them in the beginning and we paid top price for them when we got them. They were either dirty, broken, and thankfully we got our money back. But I think in those early days, when we were really trying to figure all this out, and policy was changing every 15 to 20 minutes, and you're trying to secure PPEs and you're trying to figure out the best way to keep everybody safe, you're spinning your wheels. And it is I've been doing this for 30 years, and I've never experienced a level of stress and anxiety that over these last 9 weeks that I had in my whole 30-year career.
That's saying something.
Because you're constantly, and everybody is, but you're constantly worried.
Yeah.
And you're constantly making sure and hoping you're making the right decisions every time. And one of the byproducts that's been good so far is our communication here at Bridgewell has actually gotten a lot better. So
right to the point too, I would imagine.
Yeah.
Right. No fluff or like BS. Right. You're like right to the point.
there's no anecdotal kind of, hey, what'd you do last night? It's what are our numbers? Who tested? Who's positive? But right from the beginning, we instituted 3 meetings. So even today, we have a 9 o'clock meeting with senior leadership to go over what has happened the night before, what do we have to tackle today, new positives, what are the needs. At noon, the executive team meets to talk about where are we today, are we accomplishing what we talked about at 9, what do we need to get done this afternoon. And then at 3:30, we have a meeting with senior leadership and with our residential directors to talk about how was your day, what do we need, and all that, to keep the lines of communication. And a big part of that is our healthcare coordinators are on the line, and they're in charge of our PPE distribution. So we have, in one of our day programs, we've converted one room into our distribution center for PPE. So all our PPE goes there. The 1 or 2 people we didn't lay off for transportation, their job is to drive PPEs throughout the agency, make sure programs have enough. But we've been meeting like that for the last 9 weeks, and that has helped. And it has helped lessen the anxiety to a degree.
Yeah. You shrink it down into manageable bites.
You do, and the communication is really flowing, and it worked really well for us. About 2.5, 3 weeks ago is when we hit our surge, where we took advantage of DDS and Fallon's mobile testing, and we got all our programs tested and a good portion of our staff. And about 2 weeks ago, every meeting we were getting test results in, and the test results were all positive. These 3 individuals tested positive, these 7 staff tested positive, and our Merrimack Valley programs got hit the worst, which makes sense because that's Middlesex County.
Yeah,
which is got hit the worst, and
more population density.
Absolutely, and so with these meetings, we were able to kind of game plan about how we were going to improve staffing, how we're going to make sure people had everything they wanted. But it has been it has been a roller coaster. But that's one of the benefits is our communication has got a lot better.
So I would imagine this is, you've had to adapt or evolve, where have you seen, creativity or innovation kind of arise out of this?
I think there's a couple things. So telehealth being one of it, and how we can really embrace that more. And I'll be honest with you, I'm talking specifically for the clinics now. I was not a huge fan of telehealth prior to this. I am very old school. When you talk about therapy, it's best done face to face. I understood the need for telehealth, especially in rural areas and all that. With this is really, this one has opened my eyes about the possibilities of expanding our telehealth and the benefits that it takes. So I think that's one area that we'll continue to look. Not going solely to telehealth, there is still a great benefit to seeing somebody face to face, having that in-person relationship. But I think we probably can reach more people as we expand our telehealth services. The other major area is we have to re-examine how we provide day programming and employment programming for our individuals. The biggest hit we've taken outside of transportation is day programming. Now, we're providing day programming in our residential programs, and that's actually working really well. We've seen behaviors decrease. We've seen staff engagement increase. So we're currently looking at that and trying to examine, okay, how can we continue to make that happen? Because I don't see a time in the foreseeable future that, though our day programs will open again, they will not be open to full capacity, meaning our Rosewood 1 program can hold 90 individuals. I cannot foresee a time that I will have 90 individuals in that building in the foreseeable future. Yeah. Everything we do is going to be staggered.
So you got to plan for the worst, right?
Absolutely. And knowing that, if you listen to the experts, more likely we're going to hit another surge in the fall, winter. And depending on who you listen to and who wants to scare you the most, it's either going to be about the same or worse.
Right.
So for us, in working with our state partners, is how do we enhance our day programming in our residential programs But also we have, you know, a lot of our individuals who go to our day programs live at home. So then how do we expand those services to in-home service day programming?
Yeah.
So I think that's the area that we're really going to be focusing on. And the other area is going to be our employment program. We have to be a lot more creative around employment, excuse me, especially going forward, because again, listening to the experts and seeing the trends, there I just saw on the news today another 2.5 million individuals signed up for unemployment. I think that brings the number almost up to 30 plus million Americans are on unemployment. The unemployment rate is going to be anywhere between 20 to 25% for the foreseeable future.
Yeah.
That really impacts our individuals getting a job. So we have to really start looking at what our employment program is going to look like, and who can we partner with and kind of redesign that program.
Yeah, everything under day seems to be like it's the amount of innovation coming into the day services side. I think it's just going to, you know, increase exponentially, because you're going to have to, and people are going to, you know, go down the road of testing new concepts and new business models and see where they go. But there's just going to be so much innovation there. It's as much as it is a crisis, it's an exciting time to see how things are getting transformed and revolutionized.
Well, generally things don't change unless there is a crisis, because generally
that's about true.
In our field, we get very comfortable.
Yeah,
well, we've been doing this for a while, and so this seems to be tried and proven, so this should be okay. And usually it's a crisis or a huge shift that gets us to kind of change a little bit. So I agree with you. This is an opportunity for all of us to kind of look at our practice, what we've been doing, and how do we adapt.
Yeah.
And I think that's what's going to be happening. I don't ever foresee again that day programming will ever be just purely brick and mortar, everyone going to one site and all that. I really do see that it's going to be done in the community, in programs, and in homes. And there'll still be site-based day programming, but it will be limited, and it will be specific to a specific task or objective. And for us, it will be helping our staff adapt to that.
Yeah.
And change. And that's going to be that's the other challenge. And I think for all of us, we will mark this period in time of pre-COVID and post-COVID.
Yeah.
And post-COVID is going to look very, very different for the human field sector.
So if we play Monday morning quarterback here, right, and we look at, not that you could have predicted this, right, but would there have been ways to make the organization more resilient, more prepared, more adaptable going into crisis? And crisis could be, you know, pandemic, or it could be large scale things of equal or you know, sizable caliber. You know, could have anything been done to make the organization more resilient?
I think, you know, for us, I think we could have been talking about this a little bit more. Not necessarily COVID, but every organization has a COOP plan. And the COOP plan was developed for the bird flu and swine flu 10 or so years ago, and we all had to do it. And for most organizations, and Bridgewell being one of them, we have a COOP plan. We kind of review it every year because we have to, but it kind of sits on a shelf, and we get tunnel vision of what's in front of us. Mm-hmm. And I think if I could go back and, you know, when we first heard about COVID in December, January, couldn't foresee that it would ever, you know, jump the pond and come to us. But I think reviewing and really actively talking about catastrophic events. We're really good about the blizzard that's going to come. We're really good about, we've had 2 floods in our programs over the last 2 years. We're good about natural disasters.
Right.
We know what to do when the power goes out. We know what to do when the snow comes. We even know what to do when the tornado and the hurricane comes. We don't talk about the pandemic. We don't talk about the widespread. You know, when this first was kind of making its rounds, our internal, in all honesty, our internal conversations were like, okay, people are saying it's like the flu. We can manage the flu. We managed the flu in the past before. We're fine. So I think it would have been moving forward. Uh, it would have been, we would have talked more in depth and been more, have more practice and procedures in place to be ready to deal with this.
Yeah, more responsive.
Yeah, and I think that's it, because where I think for ourselves, Bridgewell, and I would venture to guess most human service agents, we were woefully unprepared for the need of PPEs.
Yep.
And that was the biggest take. And we are now, like everybody, stockpiling for the next surge, and PPE buying will become just a normal part of Bridgewell. We will continue to maintain a certain level of PPE for the agency for the foreseeable future. But that has been, I think that's the biggest area. And for Bridgewell, what we're going to be doing in the next couple of weeks is we're going to pull everybody together, and we're going to deconstruct
That's great.
our response. And
Do like an after action review.
absolutely. And part of that starts today. I have a 3:00 call with Bridgewell has a family advisory committee. I have a 3:00 call with the family advisory committee today to start that process around how was our response, how was our communication, suggestions for moving forward and all that. But we need to do an internal look at what we did well and what we didn't do.
So I mean, when you look at, or I should say, the CEOs that I've talked to in the past, 2 to 3 weeks, who I think are now kind of moving out of crisis mode and really starting to think about the future, that conversation is really, broken into two parts. It's broken into, the future being decisions that have to happen in the next 3 to 6 months, right? Which could be substantial, given the evolution of changes and funding cuts and things like that. And then there's the long-term viability. What do you see things looking like over the next several months and then the horizon beyond?
The next several months, in all honesty, are scary. They really are. It's, I was on a conference call about 2 weeks ago, and I was texting back and forth with a colleague, and he was asking if what I had heard about potential budget deficit for the state and all that. And the numbers coming out of the state are anywhere between $4 to $6 billion next year as a deficit. And I had texted back to him saying, do you remember 2009, 2010? Because that's what we're heading towards. So I think the next 3 to 6 months is the great unknown, because we don't know what the state budget's going to be like. So that makes it really impossible for agencies like Bridgewell to develop an internal budget. So we're developing our internal budget for fiscal 21, but there are several unknowns for us that makes it hard to kind of project where we're going to be. I think in the next 3 to 6 months, agencies like Bridgewell, and specifically for Bridgewell, we're going to have to be looking at viable services. We're going to have to be looking at what are some of the services that we've had that have been on the cusp or losing money, but we've been able to offset it with other programs. Can we continue to offset those programs in the future? And I think for all of us, there are some very difficult decisions that we're going to need to make, because we all expect 9C cuts next year. We all expect that our funding sources won't have the revenue that they have this year, and that's obvious to be able to support. And then I think for the future, what I've been talking with the team about is more on the innovation part. Okay, so now we have to reinvent some of our programs. Let's start having that conversation now. Let's start putting that into practice so we can really roll it out in 6 or 7 months. So I think that's, as much as next year is anxiety provoking, and there's a great fear of what it might be, there is also an opportunity to reinvent your agency and reinvent your programming. And I think people, especially for us at Bridgewell, people are open to that. I think they've seen that, probably for a while we've been too comfortable and that maybe we have not always internally been looking at how to adapt, how to be innovative, how to kind of change. And I think this is kind of
but to significantly do that, being intentionally disruptive or almost cannibalizing your business model with, potential new ways of being, right, has kind of got a fire lit under it, versus, change maybe taking a couple years now is taking weeks or days.
it's taken days. Yeah, no, absolutely. And I think what's working well for Bridgewell is, as you know, we've been going through our own reorganizational change
Right.
for this last year. And even though COVID happened, our organizational change hasn't stopped. So we've made significant internal changes, and that's helped light that fire and keep that flame going of innovation and change, which will suit us well months down the road. We do, I think, for all of us, the next 3 to 6 months is about survival mode. It's how do we get through it? How do we end this fiscal year? And how do we end it in a way that we are still healthy?
Yeah.
And then how do we project what we're going to look like next year? And how do we get through the first 3 to 6 months of next fiscal year, knowing that whatever fiscal help we got this year from the state, which was in some areas significant, and I'm grateful for it, that's not going to be there next year.
Yeah.
And so then how do we cover those costs, and what decisions do we have to make?
Yeah. So if you had to give a message to other CEOs, because there's a lot of nonprofit CEOs out there that are operating small organizations, all the way up to the large ones, like Bridgewell. What would you like to share with them, or any kind of messages you want to deliver to the leadership in the nonprofit community?
I think it's all that we all have to hang in together. I think and that's it. We are a small community that does an incredibly important job. And we all have an awesome responsibility, because it is our job to take care of somebody else's loved one. And so I think for all of us, and what I would say to my colleagues is, we need to band and stay together. We need to be able to communicate with each other. We need to be able to talk, bounce ideas off each other, help each other out as best as possible. I mean, one of the nice things that has come out of this is, for some of the larger organizations like myself, Northeast Arc, and some others, we've been able to be hubs for other smaller providers to get PPEs.
Yeah.
And we've been able to, because of our size, front the money up front to buy it, and given the smaller agencies time to be able to pay us back, but still getting their PPE. So when I think of the future, those are things that we need to still continue to do. That one of the things, and the nice thing about our sector over the last several years is, we've been moving away from this competitive feel, where 10 years ago, you really wouldn't talk to your what you would call a competitor about what maybe new business you're looking at, or what new home you're kind of working, because you never wanted to tip your hand. Over the last 10 years, that's gotten a little better. And there's been much more of a collaborative kind of approach. With COVID and all that, it's just all about collaborative. We're all in this together. Nobody is getting through this unscathed. Nobody is getting through this without taking a hit. And so my hope would be for all of us that we continue this collaborative approach that we've had, and work together in the future, and look at developing formal and informal partnerships to kind of work our way through this, and work our way through what the next several years kind of look like. So
Yeah.
that kind of would be the hope.
Yeah, that's a trend I'm seeing as well. Stronger together, and being able to have the resources that are going to be necessary to help transform some of the business models. I mean, it's, as much as this is a crisis, there is so much opportunity on the horizon with new types of conversations that are just, they're exciting to be a part of. Scary as hell, because it's the unknown, but really exciting to see.
It is, and I think there's an opportunity for us to even further our partnership with our state partners, because I think as much as we're transforming, I think the state is seeing that also. Is that
Amen.
I think hopefully they'll be open more to new initiatives and innovation and change. And, at least in the Northeast, talking with the Northeast Regional Director, she, I think, has always been open to new initiatives and new changes. So that's my other hope, is that the state kind of loosens up a little bit
Yeah.
and embraces change as much as the provider community is embracing change.
No, that's a really good point, because I actually had a conference call on Monday with a company that provides AI services for group homes, and the AI is built around a sensory system within the kitchen that increases the safety levels of operating a kitchen, whether that be on the staffing side or on the individual serve side. And it was incredible to see some of the things that they could put in place. But I think you would run into a lot of restrictions on the state side. And, if they're willing to explore innovation, I think there's a lot of opportunity out there to maybe even augment some of the staffing vacancies, or better support the value add of ensuring the staff have the time to engage with the individuals and focus less on maybe some of the non-value added activities.
Absolutely. And again, that sounds really interesting.
I'm gonna send you the link following this interview, and we're going to talk more about that.
My head's already thinking, but that's my hope. And again, I think what we've all experienced is on the local level. I think local level and state government and with state agencies, people get it and they want to see change. It's how we impact and influence once you get past the local level.
Yep.
When you get to the regional or the central office level, and like anything else, it's where everyone's risk adversity is how comfortable are they with certain risk.
Yeah.
But it is my hope, if anything positive comes out of this incredible tragedy, when we think about the lives lost, not just in the state of Massachusetts, but nationwide and worldwide, the hope is something good has to come out of this. Something positive has to come out of this tragedy. And if it is our ability to change how we've been providing service for the better, then that will be one positive that comes out of this. If we work more collaborative as partners with the state and with our other sister and brother agencies, that's the other positive that comes out of this, because that just benefits our individuals, our families, and everybody else.
So I mean, I always like to end on a fun note. Any bright spots or just amazing things that have come out of this crisis that are worth noting?
What's come out of this that I think has been inspiring for me is the creativity of the staff and the programs. So one of the hardships truly has been that since March 16th, families have not been able to come on site and see their loved ones. So you're going 9-10 weeks now. I have program directors with iPads and others that are doing Zoom family dinners. So and providing Zoom family calls, and I know a lot of providers are doing it, but that the Zoom family dinner has gone a long way with a lot of our families that have happened. There's just been a lot of creativity within the programs around keeping our individuals busy and engaged. I think the funniest thing that has happened since we have started this is early on, a lot of people weren't used to Zoom, WebEx, Go meetings, whatever you might want to call them. And the early meetings of people not realizing how to mute themselves was funny. So you're on a Zoom call with 100 people, and every 5 minutes, somebody's saying, "Can you please mute your phone?" And we were on a call, and there was somebody's spouse came in the room, and they said, "What are you doing?" And I won't repeat the language, but the person on the call said, "I'm on this bleeping call with these bleeping people, and I don't want to be on this call." Oh, it was great. It was great. Everybody, it was open. People are screaming.
Hours of entertainment, right?
It is. And it's just that the first 2 weeks was just every 3 minutes, somebody saying, "Can you please put your phone on mute? Can you please put your phone on mute? Your camera's on. We can see you. Can you please turn your camera off if you're doing that?" People have gotten better, but that was entertaining, and it was entertaining in all honesty to see how angry people got when people didn't put their phone on mute.
Yeah.
But I think the other part is, at least for Bridgewell, we're not as serious as we used to be. I think people realize some of the stuff we used to get upset about,
The
and
small
that
potatoes.
really, yeah, that really kind of caused us angst, be it interoffice issues or little stuff. That has all gone by the wayside. It's just, yeah, I don't, I think people, we know what the big picture is. We know what we should be worried about. Everything else is small potatoes. So I think people's personality and sense of humor has come up more, and that's been nice.
No, that's great. That's great to hear. And I really want to thank you for your time for the interview this morning. And I especially want to thank your staff from the bottom of my heart for all the work that they're doing, the countless hours that they're putting in. I know it's a lot, but they do amazing and important work to take care of other people's families, which is incredible that they have to balance their own as well as others. So, for those that are watching, if you want to find out more information about Bridgewell, click the links below. As always, we hope you subscribe to hear more interviews from more great leaders like Chris. Thank you.
All right, thank you.